A week before finals, room 229 in the Wayne West building of Carteret Community College transformed into a simulated disaster scene.
This was a mock test for like a bomb going off, and so it was a big explosion. As you can see, the room is just trashed, and a lot of the injuries would reflect something that would happen to the victim of the bomb. We had multiple fracture injuries and burns and lacerations.
Student Brian Odd played a victim in the scenario.
Well, I was alive for the first minute or two, but then I slowly slipped away and they had to mark me as dead and go about their procedure.
While Odd could not be saved, a half dozen others acting as injured could. Senior nursing students like Tamara Batiste rushed to the room to help. They were surrounded by blood, broken bones, death, and destruction.
It was quite chaotic. And really, it was a little distressing to hear all of the cries for help and wonder what direction should I go in first.
Nursing instructor Marilyn Springle says they did everything they could to make the simulated disaster seem as real as possible.
We need to help them to determine what actions to take in an unfamiliar situation. They have to make critical decisions. They have to use critical thinking to decide this is the priority patient, and allowing them to do it in a simulated situation, making it as real as possible, is the best we can do to prepare them.
The victims were covered in fake blood and wounds to represent life-threatening injuries.
It was disconcerting because there's like limbs missing and there's eyeballs hanging out of people's heads, and it was actually quite real.
Batiste says the exercise taught her to zero in on people who aren't necessarily being the loudest, but who are more injured than others. She and her classmates went straight to work, analyzed injuries, and started treating their patients. They quickly transferred the victims to a treatment area across the hall.
Well, I've never done this before. I've never responded to a disaster on any level. I've never really been part of a disaster. So having this opportunity has really given me an idea of how to organize my own thoughts and my own thinking patterns so that I can really impact the lives of people and save them instead of just really responding and reacting. Having training, it makes a huge difference, and the knowledge that I've gained in the nursing program has really helped me to be able to respond in the right manner and at the right time to the right people.
Through this mock exercise, Batiste got a taste of what a real-life emergency situation could be like, preparing her and the rest of the students for the worst.
It lends confidence to me, and hopefully it will to them, that they can respond when called upon, because sometimes if you just learn about something until you can put it into action, you don't really know whether you can accomplish that or not.
And when these students graduate in May, Springle says that confidence will transition with them to the workforce.